Hey breasties, we got to talk about this article that came out last week in New York Magazine, Blindsided by Breast Cancer When a Mammogram Hides a Deadly Truth. Now, the title's a little clickbaity for me, but I'm happy that dense breast tissue is finally getting the attention it deserves, so let's talk about it. My name is Dr. Robin Roth, aka the Booby Docs. I'm a board-certified radiologist specializing in breast imaging, and I'm also a strong supporter of supplemental breast imaging in the setting of dense breast tissue, so there is a lot that we can learn from this article. So the article details Angie McCoy, who was a woman back in 2020 who noticed that something was off with her right breast. It wasn't a discrete lump, but something felt different. So she saw her general practitioner, who appropriately referred her for a diagnostic mammogram and ultrasound. So the radiologist said he didn't see anything on the mammogram and ultrasound, but you do have dense breast tissue, which was something she's been told before, but she said she didn't understand what that meant. And the radiologist, it sounds like, gave her a BI-RADS 3, which means that he's saying it's probably benign. He's saying that it's a less than 2% chance of this being cancer, and he wanted to see her in 6 months as a follow-up. Unfortunately, her symptoms got worse and she started to notice that she was having pain, and she saw that her right breast was severely inflamed and doubled in size. And it sounds like she was clinically developing inflammatory breast cancer. A few days later, she talked to her primary care doctor, who basically dismissed it as nothing serious and ordered another mammogram and ultrasound, which honestly sounds like a little bit of medical gaslighting to me. So again, she goes back to the radiologist's office and he says he doesn't see anything on mammogram and ultrasound, but if you want to be 100% sure, if you need to get a biopsy. And this is the most important part of the story, is that she was having a clinically enlarging inflammatory breast cancer. Despite a negative mammogram and ultrasound, she still needed the surgical biopsy and an MRI to evaluate the clinical findings, which were concerning. This, unfortunately, is a common clinical scenario that we see often in breast radiology. And of course, she gets a biopsy, which confirmed that she did in fact have breast cancer. And this is what her MRI looked like. It had a few masses that were not seen on mammogram and ultrasound. And also, she unfortunately had metastatic disease. And the question this article is appropriately asking is, should all women with dense breast tissue be screened with a breast MRI? And the answer is it depends who you ask. But first, I think we need to talk about breast density and why it is so important. So breasts are composed of fat and fibroglandular tissue, and fibroglandular tissue appears white on a mammogram, and so does breast cancer. So the more fibroglandular or dense breast tissue you have on a mammogram, the harder it is to see a small breast cancer using mammography alone. Think of it like trying to find a snowflake in a blizzard. The more white snow you have, the harder it is to find a single snowflake. About 50% of women have dense breast tissue. It is not abnormal, but it does make it harder to find small breast cancers using mammography alone. We also now know that it is an independent risk factor for developing breast cancer. So having dense breast tissue is like a double-edged sword. It makes it harder to find small breast cancers and it increases your risk. The only way to actually know your breast density is by reading your mammogram report. If you see heterogeneously or extremely dense under breast composition, then you have dense breast tissue and you really should consider supplemental imaging, such as ultrasound, MRI, or contrast mammogram, which we're going to talk about. And you're probably wondering, is dense breast tissue really that limiting on a mammogram, or are you radiologists trying to cover your ass? And I would say it's really that limited. This is a regular 2D mammogram and this is a contrast mammogram. You can see that this woman has bilateral multicentric cancers that you really cannot detect on the mammogram. We know that MRI is the most sensitive imaging modality that we have for breast cancer screening. The main reason we don't do breast MRI on everybody is cost. Breast MRIs are about 10 times more expensive than a mammogram, often cost people about $1,000 out of pocket. They also take about 45 minutes and the patient has to be lying on her belly in the magnet with her arms above her head. So it's not feasible for many people. Also, it's not nearly as accessible, meaning you might not be able to have access to a breast MRI. MRI is the most sensitive, meaning it's going to detect almost all types of breast cancer. But the downside is that it's not specific, meaning that benign things can enhance as well. So if you find something on an MRI, you often can't tell whether it's benign or malignant. You have to biopsy it. And let me be the first to tell you that MRI biopsies are not very pleasant. So breast MRIs are typically reserved for people that have dense breast tissue and other important risk factors such as family history or genetic mutations. Now, ultrasound is a much cheaper imaging test. It's widely available. And by adding an ultrasound to a screening mammogram, we're able to pick up another 2 to 5% of breast cancers, but it doesn't close the gap entirely. There are newer imaging modalities out there, including abbreviated breast MRI, which is a very quick breast MRI that may cost 10 times less than a true MRI, and also my personal favorite, contrast mammography, which is like a mammogram and an MRI had a baby, and it really overcomes the limitations of breast density on a mammogram. So do I think that all women with dense breast tissue should consider supplemental imaging? Absolutely. Do I think that everyone with dense breast tissue needs an MRI? Not necessarily, but I do think it is a really important conversation, and we understand an individual's breast cancer risk so we can decide whether or not MRI is warranted. Also, insurance is going to be ultimately the decider whether women with dense breast tissue have access to MRI. I do think we strongly need to consider looking at abbreviated MRI and contrast mammography, which are cheaper alternatives to breast MRI, and they are more widely accessible. But I think this article is really important in helping people understand dense breast tissue and why it's so important, and also highlighting the important fact that if you have a clinical area of concern that is enlarging, despite a negative mammogram and ultrasound, that needs to be biopsied and followed up clinically, either with a surgeon or an MRI. Would love to know your thoughts on this article. And as always, follow the Boobie Docs for more of the breast information.